All right, so today I'm going to take you through some controlled articular rotations, which in short is what we call CARs. And this is a series of movements to actually take your joints, every joint in the body, head to toe, through its full range of motion. And I love to do this also as a warm-up pre-workout, or even just taking a break at your desk, or if you're a commercial break during your favorite show, just to get your body moving. So we'll actually start at the neck and we'll work our way down all the way to our ankles. So for the neck, you really want to isolate the movement. So you don't want your body moving, or compensating through any of these. So with the neck, what we're going to do is try to lock off the trunk and the shoulders and keep them as stable and as steady as you can. And just through your cervical spine, so just through that neck, you're going to take it in nice round, big circles. So you're trying to create the biggest circle you can without your body moving. So really lock in those shoulders. Be very mindful to not push through anything that hurts, nothing that's sharp, nothing that's stabbing. You might be a little tender or stiff, and that's okay. You can definitely, move through that. You might even have some crunchies here in the neck. That's okay too, so long as it's not causing you any pain. Change direction, other way. So if you are experiencing a little bit of pain or discomfort with this, just try to make your circles smaller. The idea here is to find your range of motion that is completely pain-free. As for repetitions, just do what feels good. Anywhere between 5 to 10 in each direction is probably suffice. But listen to your body. If you feel like you need more, go ahead. Good. Now let's go into the shoulders. So we're going to really isolate the glenohumeral joint. So that's that shoulder joint here. And what I want you to think about doing is keeping the fingers right attached to the side of the leg. So you don't want your hands going forward or back. You're really trying to isolate just that shoulder joint. So I'll show you from a few different directions. What you're going to do is come up into elevation, back into retraction, down into depression, and then forward into protraction. And then trying to make that into a nice big circle. Again, whatever that range of motion looks like for you. So I'll show you from the side. So that's up into elevation, back into retraction, down into depression, forward into protraction. Keeping those elbows as straight as you can. Try not to bend those elbows. Try not to let the hands come away from the body. Keep that nice and straight. Really isolating those shoulders. And then now try the other direction. So up until elevation, forward into protraction, down into depression, and now back into retraction. Forward usually feels a little bit more awkward. It's not as comfortable. We don't often go into this direction with our shoulders. Just do your best here. Good. And the next one is shoulder flexion. So I like to do these ones with my one hand just underneath that breast line to really make sure I have some tactile feedback to stop my ribs from flaring. So when we bring our arm up, sometimes a compensation is to let the ribs flare. So we're going to put our hand here to stop that and to remind us that we're going to leave that spine nice and locked and nice and loaded here. All right, so this is what this is going to look like. You're going to bring that arm up. Again, no bending the elbows. Get it up as high as you can. It might be here, and that's okay. Just get up as high as you can without any rib flare. And then at the shoulder joint, you're going to start rotating and coming back. So you finish with the back of your hand to the thigh. And then you reverse it. Now come up, you kind of get stuck here, right? I can't go any further. Now at the shoulder, uncoil, and then come back. Then you finish with the palm of your hand to your thigh. So again, come up, get to your end point. Now rotate at that shoulder, twist, finishing with the back of the hand to the thigh. I'll show you from the front to reverse it. Good, so one more on this side. Come on up, rotating at that shoulder, finishing with the back of the hand to the thigh, and then reversing back out of it. Good, let's try the other side. So again, coming all the way up as far as you can. Start to rotate at that shoulder, twisting, bringing the back of the hand to the thigh, and then reversing out of that. Good, I'll show you again from the side. So coming up into a shoulder flexion, start rotating out, and then reverse it. Do one more on this arm. Again, remembering to not push through any pain. Meet your body where it's at. Awesome. So now we'll go into the wrists. I like to hold my wrist here and just have that thumb on my forearm. And then you're going to flex your fingers. So nice, strong fingers, nothing relaxed. You put tension into those fingers. And now you're going to try to isolate the wrist joint. So you're going to try to make a big circle as you possibly can, without allowing your wrist or your forearm to turn. So that's why I like to put your hand here. So it's going to look like this. Come down to the side, all the way up. So you're here, not here. Don't let your fingers cup. Coming down and back around. Really keeping this forearm facing the ceiling. So there's no compensation coming through there. And then other direction. The wrists are usually quite difficult to isolate. So give yourself patience. Take lots of practice to get a good circle here without moving that forearm. Good. And then you can go into the other side, doing the same thing, holding that wrist, coming up to the side, down and around. Just making sure you have nice strong fingers, no cupping. Your body's going to try to compensate and it's going to want to cup. So really make sure they're nice and strong fingers. And other direction. Great, fantastic. All right, so now we're going to go into your hips. So you're going to come into all fours like this. You're going to stack your shoulders on top of your wrists, and you're going to stack your knees right underneath your hips. And then from here, you're going to lift one knee off the floor. You're going to bring it in towards your chest, out to the side, out towards the ceiling, and then back into the chest. And you're going to reverse it by going up towards the ceiling, out to the side, and back in towards the midline. So again here, you really want to focus on not pushing through any discomfort or pain. And just think about drawing a circle with your knee. And then just going into both directions. So I like to alternate it. Draw one circle one direction, and then draw one in the other direction. And then you can switch sides. This one I'll show you from the front. So lifting that knee up, coming into the chest, out to the side, back up to the ceiling, and down towards the chest. And then reverse it. And you're really trying to focus on your spine here as well. Making sure that when you go into your circles, your spine isn't arching and collapsing. You're trying to keep it fairly neutral as you isolate that hip joint. All right, so now we're going to go into your knees. So if you can, come down into this position here, and you're going to stick your arm underneath your knee, underneath your leg. You're going to pull it up like this. This hand is going to grab your bicep. This hand is going to come underneath, just on your shin there, underneath your knee. And what you're trying to do here is pull your thigh into your chest. So it locks in that thigh bone and it locks in your trunk from moving. So what we're going to do here is we're going to isolate just your knee. So pulling that in, sitting up nice and tall. Now what you're going to do is move your foot side to side. And underneath this hand here, your right hand, you should be able to feel your shin moving from side to side. But your thigh bone, your femur bone, that's pushed into your chest, that's not moving. You're keeping that nice and locked, and you're only moving your shin, which is actually just moving that knee very gently side to side. So you're getting some lateral movement there in that knee. So once you have that, let's go into external rotation here by pushing your foot outwards. And then you can come up, lift it as high as you can, and then bring it back down. Now go into internal rotation, lift it up again, coming back down. So again, external rotation, lifting it up, and down, and switching. So this is really good to do if you have knee pain, or if you have anything going on with your meniscus. This is a really good exercise to do to help flush out inflammation from that tissue and create more range of motion through that knee. Good, and then let's switch to the other side. Again, grabbing that bicep, hand here on the shin. I'll show you from a little bit different angle. So again, just lock that thigh bone into your chest. Move that ankle side to side so you can start to feel that shin moving underneath your hand. And then let's go into external rotation, lifting up, coming back down, internal rotation, up and down. Again, you can do 5 to 10 repetitions each direction, whatever feels good for you. Good, last one. Great. So the last one I want to go into is your ankles. So with this one, I like to sit into this position and grab my shin here like this. If this is uncomfortable for you and you can't get into this position, stay in this position. You can also do your ankles here. All right, and then you can just bring them into circles here. But I like to do it this way if you can. So I like to take my pointer finger and put it right here on top of my ankle. And this hand is going to give me tactile feedback as to not moving the shin. Now we do not want the shin to move. We only want the ankle to move. Now it's gonna look like this. So locking it in, and then I'm going to try to draw the biggest circle I can with my foot, with my toes, without letting my leg go all over the place. I'm locking that in, really isolating that ankle. Good. Try the other direction. Again, just trying to find that full range of motion. You'll probably find some sticky points here, especially in the ankles. There's usually lots of crunchies. These are really good to do if you're a runner or if you've had previous ankle sprains or breaks, it's really good to break up some of that scar tissue and get some good blood flow and circulation into those feet. Good, now you can try the other side. Same thing here, locking in that shin and drawing nice big circles with those toes. Again, remember, no pain. I should feel fairly comfortable. Changing directions now, other way. Awesome. So there you go. You have a full body head to toe joint circle routine, some controlled articular rotations, and definitely do those every day if you can, first thing in the morning or before you start exercise, or just as little movement snacks throughout your day. And yeah, comment below. Let me know if you've given this a try and how your body's feeling.